One of the important emotional expression is crying. When we cry excessively, we can feel that the tears are flowing through the nasal cavity. Have you ever wondered what is the reason behind this? The reason behind this is the lacrimal apparatus. Once we learn the anatomy of lacrimal apparatus, we will come to know the exact anatomical pathway of drainage of tears and how secretion of tears is actually controlled by innervation. In this session, we will first talk about the components of the lacrimal apparatus. We will list the components to begin with. Then we will describe each of the component in detail, and we will learn in detail about anatomy of lacrimal gland with respect to its part, its location, its function, its arterial and nerve supply. Then we will talk about the anatomy of the lacrimal sac, the lacrimal canaliculi, the nasolacrimal duct. With this, let's begin the session. The lacrimal apparatus includes two distinct components. One is the secretory component and the other one is the drainage component. The secretory component is mainly formed by the lacrimal gland, which releases its secretions into the conjunctival sac. From the conjunctival sac, it is carried into the lacrimal puncta. The lacrimal puncta actually leads into the drainage pathway formed by the lacrimal canaliculi, the lacrimal sac and the nasolacrimal duct. Let's begin with the anatomy of the lacrimal gland. As the name suggests, lacrimal gland is concerned with the production of tears. Lacrimal gland is divided into two major parts, orbital part and palpebral part. Orbital part is located in the lacrimal fossa of the roof of the orbit on the lateral side. This is the main part of the lacrimal gland, and this sends in few ducts. These ducts pass through one small part of lacrimal gland called as the palpebral part. As the name suggests, the palpebral part is part of the lacrimal gland present in the eyelids. The importance of this part is this also gives rise to ducts, but the ducts of the orbital part also pass through the palpebral part. Now, what is the importance of knowing this presence of ducts through the lacrimal palpebral part of the lacrimal gland? Remember, since all the ducts of the lacrimal gland pass through the palpebral part, removing just the palpebral part is as good as removing the entire lacrimal gland. This is because the ducts of the palpebral part as well as ducts of the orbital part pass through the palpebral part, right? This is regarding where exactly the lacrimal gland parts are located. The function of lacrimal gland is secretion of tears which keep the cornea moist. The composition of the tears is bactericidal. It also helps in performing the immune function of the protecting the structures of the eye, right? The tear film is maintained over the surface of the cornea mainly by the blinking action and the capillary pressure. Now, the lacrimal gland is supplied by the lacrimal branch of ophthalmic artery. But more than its arterial supply, what we are concerned is with the innervation of lacrimal gland. This could be an important 5 marker for you. We must know how the secretion of the tears is controlled. Remember, this is by the following pathway, right? The ganglion that controls the secretion of the tears is the Pterygopalatine ganglion. The Pterygopalatine ganglion is the largest of the cranial parasympathetic ganglions and is located in the Pterygopalatine fossa. The preganglionic fibers for Pterygopalatine ganglion begins with the lacrimatory nucleus of the facial nerve present in the pons region. The preganglionic fibers arise from the lacrimal nucleus, pass successively through the nervus intermedius or the sensory root of facial nerve, then through the trunk, then through the geniculate ganglion. The geniculate ganglion gives out the first branch, which is the greater petrosal nerve. So the preganglionic fibers pass through the greater petrosal nerve. This joins with the deep petrosal nerve, forming the nerve of the pterygoid canal or Widion's nerve. This nerve of the pterygoid canal ultimately relays in the pterygopalatine ganglion. From the pterygopalatine ganglion, postganglionic fibers arise, pass successively through maxillary nerve, zygomatic nerve, then through zygomaticotemporal nerve, and through the lacrimal branch supply the lacrimal gland. This is how the secretion of tears is actually controlled by the lacrimatory nucleus of facial nerve through the pterygopalatine ganglion, right. So removal of pterygopalatine ganglion will result in dry eyes and loss of secretion of tears, right. Of all the components of the lacrimal gland, the innervation or the nerve supply is the most important, and you must remember, you can practice doing it in a flow chart. This is regarding the lacrimal gland. Fine. The lacrimal gland has been stimulated by lacrimatory nucleus and the tears have been produced. How does the tears drain? Why the tears do not roll over the cheeks and you never feel that the tears are actually getting secreted? This is because the tears have a continuous drainage pathway. The tears that are produced by lacrimal gland enter the conjunctival sac, and from the conjunctival sac, after forming a tear film over the surface of the cornea, they reach the lacrimal puncta. The lacrimal puncta are located along the medial side of both the eyelids. So there are two puncta, one in the upper eyelid and one in the lower eyelid. You can actually identify these puncta by standing in front of a mirror and identifying them. So the tears from the conjunctival sac enter the lacrimal puncta. From this, we have the drainage pathway which begins with the lacrimal canaliculi. There are two lacrimal canaliculi, upper and lower. Each canaliculi measures about 10 millimeters in length. Each canaliculi has a part, for example, the upper canaliculi, if you observe, first goes upwards and then descends down into the lacrimal sac, whereas the inferior or the lower canaliculus first descends down and then ascends medially towards the lacrimal sac. So this is how the tears in the conjunctival sac enter the lacrimal puncta, through the lacrimal canaliculi enter the lacrimal sac. So the next part we have is the lacrimal sac. This is the enlarged and upper part of the nasolacrimal duct, measuring about 12 millimeters, the most widest or the dilated part. The lacrimal sac is located in the lacrimal fossa. This is covered by lacrimal fascia, which gives origin to the lacrimal part of orbicularis oculi. The function of the lacrimal sac is to dilate and receive the tears that come from the lacrimal canaliculi. The lacrimal sac leads to the next part of the lacrimal apparatus called as nasolacrimal duct. The nasolacrimal duct measures about 18 millimeters. The peculiarity of this duct is narrow in the middle region and wide in the upper and near the termination. The nasolacrimal duct ultimately opens into the inferior meatus of the nose. This is the reason why when tears are excessively produced, we actually feel them entering into the nasal cavity. This is the pathway, right. So this is regarding the nasolacrimal duct. Now this is a comprehensive description of nasolacrimal duct and the lacrimal apparatus. So to quickly summarize the anatomy, even before we summarize, one important thing that we must remember regarding the nasolacrimal duct is the lower part or the terminal part of the duct is actually protected by a valve of Hasner. This prevents the entry of air into the nasolacrimal duct. This is an incomplete mucosal valve. To summarize the anatomy of the lacrimal apparatus, the lacrimal apparatus is concerned with the production and drainage of tears. It consists of the following parts: lacrimal gland. The lacrimal gland consists of an orbital part and palpebral part. The importance of palpebral part, even though it is very small, is all the ducts of the lacrimal gland will pass through this palpebral part. Hence, removal of the palpebral part is as good as removing the entire lacrimal gland. Apart from the lacrimal gland anatomy, we must remember the innervation. The innervation of the lacrimal gland is by Teropalatine ganglion through the lacrimatory nucleus of the facial nerve. The lacrimal gland leads the secretion of tears into conjunctival sac. Conjunctival sac carry it into lacrimal puncta. From the lacrimal puncta, we have the lacrimal canaliculi, which leads into lacrimal sac. Lacrimal sac will further lead into the nasolacrimal duct, which ultimately opens into the inferior meatus. This is how the tears produced by the lacrimal gland ultimately ends up entering your nasal cavity. This is regarding the comprehensive description of anatomy of lacrimal apparatus. That's it for this session. Thank you.